know us on Mad Money. We are always on the lookout for game-changing technologies that could change the face of a given industry. That's why we created the Off the Tape segment, to highlight private players changing the way we do business across a host of industries, disrupting them. And right now, I think we could be witnessing the beginning of a revolution in the world of healthcare. I'm not referring to some miraculous new drug. I'm talking about a whole new way of doing business, what's known as telehealth. Basically using the internet to video conference with a doctor instead of being forced to physically go to a germ-filled doctor's office or a hospital every time you get sick. We know that Teladoc, the largest operator in the space, came public earlier this summer, although its stock has been hammered of late, along with the other unprofitable high flyers. But there's another major player in the telehealth group that seems to be growing by leaps and bounds, even if it's still privately held. And that's called Doctor on Demand. The last time we checked in with these guys, Doctor on Demand had just announced a major partnership with Dow stock UNH, the gigantic health insurance company. And just last week, Doctor on Demand announced a deal with CVS Health, the huge drugstore chain that could potentially refer millions of new patients to their service. Plus, yesterday, Doctor on Demand reached an agreement to become the preferred telehealth service provider to Blue Cross Blue Shield of Minnesota, the largest healthcare plan in the state. Some 2.6 million members. They're starting to really get a lot of customers. Now, yesterday, I got a chance to chat with Adam Jackson. He's the co-founder and CEO of Doctor on Demand. Take a look. Adam, much has changed since we've talked to you last, including a big partnership with CVS, and then some very exciting news with Blue Cross Blue Shield of Minnesota. What do these do in terms of the scale that you have, and how are you going to be able to really kind of blow it out using both of these two entities to sign up a lot of people?
Hi, Jim. Thanks for having me back. You know, those two deals are giving us really more of the same, more great stuff. It's exposing the Doctor on Demand service to literally tens of millions of CVS shoppers. They're an incredibly well-trusted brand in retail healthcare. I mean, they've even renamed themselves CVS Health. And then with Blue in Minnesota, you know, just another great health plan relationship similar to our United deal that brings our service to more patients for free or for equal to their copay.
All right, so it's CVS explains if they have a minute clinic, they might handle you, but if they don't, what happens? You get you go into the pharmacy side and say, listen, I need to see a doctor. How will they know about Doctor on Demand?
Right. So phase one of the partnership is CVS is actually going to promote Doctor on Demand on its digital properties. So CVS.com, the CVS mobile app, and it's basically going to let people know, hey, if you have a non-emergency medical issue and you're not near a minute clinic, go ahead and use Doctor on Demand. We have vetted this service. We know they're high-quality doctors. And then conversely, when there's a patient case where we want to do some sort of in-person follow-up, we're able to refer, our physicians on Doctor on Demand can refer you to the nearest minute clinic.
Okay. Do people understand the savings that they would have? Because a lot of people under the new Affordable Health Care Act, they have these very high deductibles and really have to learn much more themselves about how to rein in costs. How do you get it across to people who don't even go to a CVS, don't realize this is happening?
The entire system shifting toward these high deductible health plans and forcing patients to be shoppers now in healthcare, that entire movement goes along well with us being a $40 visit. So we do everything we can to market specifically to those high deductible plan holders and say, hey, for that first $5,000 of spend you're going to have every year, you really should think about $40 versus a $250 urgent care visit.
Adam, this Teladoc came public. It's a very good company, and we talked about how the stock might be a little pricey, but they do a lot of good things. When you go into a CVS, without picking on Teladoc, how do you make your case that you're better than the other guys?
So we're very different from Teladoc in that we are a live video platform. So you download us on your iPhone or your Android. Within a few minutes, you're connected to a doctor, and you have this live video chat, and you can share photos. With Teladoc, it's a different model. You call an 800 number. In 30 or 40 minutes, a doctor calls you back, and it's over the phone. So there's just different things you would diagnose without being able to see the patient.
And does it need, obviously you need a smartphone, so I mean, it's just Samsung, Apple, iPhone, whatever, and these all work for you?
That's right. We support just about everything with a camera. So that's iPhones, iPads, Androids. We even have an Amazon Kindle Fire app, and then we work on computers as long as you have a webcam.
Well, I got to tell you, this is very exciting. And CVS, we have been recommending for years and years. You're certainly with the right outfit. Adam Jackson, co-founder, CEO of Doctor on Demand. Congratulations on those great deals.
Thanks, Jim. Good to talk to you.
Private company, can't own the stock in it yet, but it's got a lot of momentum. Who knows? Maybe one day it'll come public. Stay with Cramer. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.